Does the blood supply. The stomach has its blood supply both on the lesser curvature and on the greater curvature. On the lesser curvature, we have the left gastric artery. Now, this left gastric artery is a branch of a celiac axis, right? It anastomoses with the right gastric artery. Now, this right gastric artery is a branch of your hepatic artery. Right. So this form an anastomotic arcade along the lesser curvature. Then we have this gastroduodenal artery. So if you look at the gastroduodenal artery, this is also a branch of hepatic artery which passes behind the first part of the duodenum. Right. So if you look over here, this is your gastroduodenal artery. If you trace it back, it is a branch of your hepatic artery which is passing behind the first part of the duodenum, right? So what is the importance of this pass behind the first part of duodenum? Now the important of this is that it is often implicated in your bleeding duodenal ulcer, right? So implicated in bleeding duodenal ulcer. Then this gastroduodenal artery divides into superior pancreatico-duodenal artery and your right gastroepiploic artery. So this right gastroepiploic artery in your greater curvature anastomose with your left gastroepiploic artery. Now if you look over here, this is your right gastroepiploic artery, right, which is arising as a terminal branch from your gastroduodenal. Now it is anastomosing with your left gastroduodenal artery, which is in turn arising from your splenic artery, right? So if you look at this are your splenic artery, right? So this is your branch of splenic artery. Now this vascular arcade is important, right? This is important during your esophageal conducts, right? Now coming down to the fundus of the stomach. So if you look at this image, the fundus of this stomach is supplied by the vasa brevia, which are your short gastric artery. Like the short gastric arteries are your branches again from your splenic artery. So this is supplied by your vasa brevia, which are branches of your splenic artery, right? So there's a few important points which I want you all to remember in the blood supply of stomach. Now regarding the venous supply, they accompany the artery. The veins along the lesser curvature, they drain into the portal vein, while those along the greater curvature drain along the splenic vein. Then a vein of a paramount importance over here is coronary vein that lies on the lesser curve, right? So why? Because they get dilated in portal hypertension. So the importance of your coronary vein is that they get dilated in your portal hypertension. Now the lymphatic supply. So the lymphatic supply is very important in cases of stomach because the treatment plan of stomach cancer is also on the basis of the lymphatic supply. The surgical management, which is your gastrectomy D1 or D2 gastrectomy, is classified on the basis of the lymphatic supply. So there are various lymph node stations. So this image shows you the various lymph node stations. You guys need to remember the various lymph node station. The lymph node station 1 being the right cardia, 2 left cardia, 3 along the lesser curvature, 4 along the short gastric, Then 4SA is along the short gastric, 4SB is along the left gastroepiploid, and 4D is a right gastroepiploid. Then you have your suprapyloric and infrapyloric. 7